Welcome to Doc Talk with Prime Sports Med. I'm Dr. Jared Simonson, Doctor of Physical Therapy. I am our physical therapist here at Prime Sports Med. And so I brought a little lesson. I don't know. The topic I chose to talk about today is when to see a PT, and then also a little bit about direct access as well, if you need to see a physical therapist. So when to see a physical therapist, the two different versions are in the sense of an acute injury versus something that's been going on for a while. If you have an acute injury, say you sprained your ankle, sprained your shoulder, typically, someone comes up to ask me and says, "Is this something I should see a physical therapist about?" If it's a general sprain or strain, then usually I say give it a week and a half to 2 weeks. And if it's just a generic sprain, then usually by then it'll start to improve on its own. So kind of a wait and see approach at that point. If you have an acute injury, so again, talking about you're worried about you sprained your ankle, but you felt a pop, or you get a real immediate, real drastic amount of swelling, bruising, real sharp pain when you're trying to load, whether it's your ankle if you're walking, or put pressure on your arm if it's your arm, a pop, crack, a lot of swelling, a lot of bruising right off the bat. In those scenarios, if that persists again, even for a couple of days, then you might want to go to the urgent care clinic or get some imaging to confirm if there was a fracture or a torn ligament. But again, not a scenario when you want to see a PT. In that scenario, you want to go to an urgent care situation. But if the pain and symptoms have been going on for a while, again, so let's say take the ankle sprain, which we talk about a lot. Say you sprained your ankle, it swelled up, got kind of black and blue. It's been 2 weeks, maybe 3 weeks, and so you didn't feel a pop, you didn't feel a crack. You can walk on it, but it still hurts. At that point in time, that's usually when I say that's when you should see a physical therapist to get it looked at. Again, partly because at that point it doesn't sound like there's a traumatic injury, but the healing process is taking longer than it should. And starting with exercises to regain range of motion, regain tolerance to weight bearing, address the swelling, those kinds of things is typically where we can facilitate healing, get things going a lot faster. The most common scenario is someone says, "Well, I sprained my ankle, a year or so ago. It bothers me most of the time. Sometimes it's better." But usually in that scenario, whether it's low back pain, ankle sprains, those kinds of things, it's been going on a while. Usually when that person asks, "Hey, is this a time when I should see a physical therapist?" Usually they already kind of know, yeah, it's time to see a physical therapist. If you've had symptoms going on, anytime you're over 3-4 months, years sometimes, that's when it's a good time to seek out help, find the right exercises to get improvement in your symptoms. So that's a real brief overview of when to see a physical therapist, when not to see a physical therapist. And then let's say you decide, okay, I do want to see a physical therapist. That's where what we call direct access comes into play, meaning you can come directly to see a physical therapist, whether it's me or a different physical therapist anywhere in the state. Idaho is direct access, meaning you can go directly to see us. You don't have to see your doctor first. You don't have to get a referral first. You don't have to have surgery first by any means. But you can come straight to see a physical therapist, get an evaluation, get started with your treatment plan. And that's not quite much time at all. Go ahead.
So quick question, why do you think physical therapy works so well with chiropractic?
I think partly because both treatment modalities essentially use the body itself. Hippocrates, the father of medicine, said, and who the Hippocratic Oath is based from, says that movement is medicine. And so both with chiropractic care and with physical therapy, we're using the body itself to treat its own maladies. So we use therapeutic exercises. If your shoulder, your neck is hurting, okay, do these low grade exercises, things get better, then we advance the exercises. Chiropractic care, again, not putting anything into the body, let's get these joints adjusted. I know here we also do sports therapy where it's not just adjustments, but again, addressing fascial adhesions, tight restrictions, but it's all about, using conservative treatments, using the body and the muscles and joints within the body to heal the body itself. So I think that's a big part of why chiropractic and PT go well together, which is also why it's nice that, as things have gone on, the turf wars between PTs and chiropractors is, I think, in a lot of senses, calmed down, which is good.
So we have a question from someone, and they ask, what method of physical therapy do you specialize in?
I have a couple specialty certifications. I have two, yes, a couple. Mechanical diagnosis and treatment, so that's the McKinsey method, as well as a certified Mulligan practitioner. And those two modalities go well together. But my primary basis is the McKinsey method, which essentially looks for, one specific direction of movement, whether it's at the spine or at the extremities. You use one specific direction of movement to make the symptoms better. And it's better, and I had this discussion with the patient this morning, better is not always just less intense. Talk about, neck and back pain, radiating out, say neck pain, radiating out down to the arm. Better is also if those symptoms come up the arm, get closer to the cervical spine, so essentially getting more and more central to where the problem is. Even if the intensity gets more, that centralization is a better predictor of a good outcome than just more or less intense. But using the McKinsey method is by far the base of almost everything I do.
So what is the Mulligan?
So the Mulligan techniques are more of joint mobilizations, and they're much more localized. So let's say one that I like a lot and have personal experience with is wrist extension. So let's say someone has limited wrist extension. So for me, can you see that?
Yep.
Is it just my hand or?
I can see your wrist and your arm.
Okay.
Yep.
Well, so I broke my wrist in college. Okay, and so for a long time doing wrist extension, I could get about to there, and that was about all I could do. And so as I was going to these classes, they asked, okay, does anyone have any elbow, wrist, to want to practice the techniques? And so I have limited wrist range of motion. And so they said, first you want to identify if it's a wrist problem, not say an elbow or neck problem. So I have the X-rays, broke the scaphoid, it's a wrist problem. Okay, is it still fractured? No, it had been 10-15 years by then. So no worries about a fresh fracture, acute injuries. And so for the Mulligan technique, you adjust the positioning of the joint and then do the restricted movement. And so for me in the wrist, it was so you kind of stabilize at the radius and then press on the carpal bones. Essentially, you can realign those little carpal bones in the wrist and then go into wrist extension. And we did 10 of those, and immediately my range of motion went from, as far as I remember, it was about to there, and then now I can get up to there. And so it primarily addresses range of motion issues. At the time, I didn't have pain. My wrist didn't hurt, it just didn't move. We talk about range of motion restrictions. The Mulligan techniques work really, really well.
Are there any areas of the body that work better for physical therapy versus chiropractic?
In general, I don't think so. I think if a PT has a lot of experience and practice in any specific area, they're going to treat it very well. Same thing with a chiropractor. Experience is the best teacher. That being said, I know one specific example is here, Dr. Bauer has had a lot of experience and does really well with TMJ and jaw issues. Whereas, personally, I don't have a lot of experience, and so I haven't been very successful treating TMJ issues. And so in this specific instance, our chiropractors are definitely better than me in addressing jaw issues. But I don't think it's specifically because they're a chiropractor and I'm a PT. I think it's because he has more experience than I do with it. So as practices in general, I think both provider types, we both can treat anything very well. It's just a matter of if we have a lot of experience in working with it.
Gotcha. And I'm not seeing any more questions, so I think we are good. We can wrap up.
Okay. It's great to see everybody.
All right. Thank you so much, everyone. And we will be back next month with another Doc Talk Tuesday.